Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk to you some this morning about orthodontics versus surgery. Now, we are getting into things that we are able to do orthodontically that I did not realize several years ago that could be possible to do that. But after trying and showing these cases that we did 30 and 40 and 50 years ago and how we did it, many of these would cut out the use of surgery for several things where you can do it orthodontically. It also reduces the restorative stuff where people would come in and put bridges or implants in where we can close these spaces up orthodontically. And so that reduces the amount that has to be done by these implants or bridges and things of that nature in there. So I wanted to cover this case just one more time. We've got about 8 or 10 of these cases that we've done where we just took out lower 6-year molars and could actually use that and come out with virtually the same effect that you would have by doing double jaw surgery. Now that might create a problem between the surgeons and doing orthodontics, but it seems to be that is a fact, and it should be checked out, and you can try whatever you want to do that, to check it out and see if I'm actually right on this. If it's right, then many people that go through this terrific surgery, which is very expensive, can come out without that problem. And I want to go with this young lady. Now we have about 8 or 10 other cases like this, but this one showed up so good, and it was done 37 years ago. We did this. And so I don't think it's necessary for us to have to wait another 40 years here wandering around in the wilderness before we realize we can do this. And so people in our organization are kind of shaky as far as being able to do this. But it is possible, and it works, and not too many difficult cases about it. So I'm going to run through this just real quick. Now, this was a class 3 case. You can see the chin protruding out. This is the models, and we had it on this young lady. And she, I think, started to work for Southwest Airline about the time I was doing this, and she's still working for them, the last I heard. So you can see this is a lower 6-year molar. I'm sorry, I touched that. How do I do this where I can draw on here? Let's see. Okay. All right, this 6-year molar right here, it should be way back in this area. And so it's that much further forward, and these teeth are straight up and down, and they're still just out in front of this right here. And we're going to have to bring all this back to get her to look more normal. And you're going to have to move the roots of the teeth back in there. And the other side the same way. We had to expand the upper arch, and we did this with an 040 large, what we call a Big Daddy arch wire. We were able to do that. Now we take out the lower 6-year molars, and we're going to move these teeth back to a class 1 relation. We'll make room in here and straighten this tooth out right here. And we're going to use a good bit of this space, bringing these teeth back, and then the rest of it, we'll move these teeth forward into the space, and that the pressure of moving these forward, we're going to move this, we'll bring it back, but we're going to have to bring the upper teeth forward also. Most of these class 3 cases are cases where the upper arch is not developed properly, and in the double jaw surgery you bring the maxillary teeth out more up here. So rather than do the surgery, we just used class 3 elastics and brought these teeth out. As we brought these teeth back in, we brought the upper teeth out. And let's see how that works. Now, look at where Pagonian is right here in this area. And when we get through, Pagonian is still here, but the teeth will be moved back somewhere like that. And we had to remove those teeth back with we used a lip bumper now, moving these teeth forward to bring the bone structure out. And that's where that kind of fools people. You got to bring those teeth out to where they're sitting kind of like that in the forward position, and these will be sitting with the teeth back there to keep it to look good, for people to look like. So here we take these teeth out, and I'm going to go through it. She had a periodontal problem, and she had to keep these teeth real clean, and she definitely wasn't a smoker. I wouldn't have started this case. So anyway, we go through it, and you watch these teeth move forward now as we go, and we brought them forward and brought these back, and we brought these teeth out. We are going to expand these upper teeth with a large arch wire. I'll get in there and show that to you. Here she is, about in the middle of the treatment. We're in pretty good shape here. And now we are still, well, not the middle of the treatment, we've still got a lot of space to carry these teeth back here. He brought them back by pulling this forward, and when we get to class 1 where we want the teeth to be, we're going to stop pulling there, and you pull it with the class 3 elastics. Here is the large wire that we have learned, and I call this, rather than straight wire orthodontics, we use the brackets and it's in and out and the tip and the torque and everything like it normally does in a straight wire, but we use other things, many other things added to straight wire, and we call it straight wise orthodontics, just a smarter straight wire. We add a lot of things to it. And by teaching you how to use this wire here, you can expand any arch on any body at any age, any time during their life, as long as they've got bone enough for the teeth to bring up, brought out. You have to use a rectangular wire to bring the root tips out as you bring the crowns out. Now, you have to do that. And so that's the way we expanded the upper arch. We used a large arch wire like that. And now we bring these teeth back, and we turn, get some space in here. We turn this tooth around, and the flat side was facing the end. When you turn them, it tends to strip through there. but we keep this good and clean and everything, and we'll torque this root in here, and that'll make this tissue go back around the tooth and help some. You'll watch that happen as we go through here. Now it's still out there, but we're putting torque on it and bringing that root back in on that tooth. And we still have some space. And during the treatment, she put on a few pounds, and then she lost that and kept up her girlish figure, everything, and she looks better. She lost that. But as we brought the upper teeth forward, we had to use run interference. If you want the bone structure to move out, you've got to run interference for it and have this soft vascular bed that can help the bone develop as it moves forward like that. So that's a necessity to do that. Now down here we brought these teeth back. You see this tooth is looking better now, this tissue line over. So we'll torque it back as we go through it. Now we've closed this space except for a little gap right there. And this takes some time to do this, but if you avoid a surgery, it's getting where it'd be around $100,000 doing that, and the danger of taking the maxilla loose and putting it in the back. And I've worked with a surgeon doing that, and I've helped tie the maxilla back up there and wished it, I hope that they would heal up. And we brought her back. This is without any surgery now. We have corrected the class 3 problem. We brought the upper teeth back. Now you look at it, and these teeth, we didn't just, like we used to do a long time ago, you'd have a class 3 somebody, you'd strain these teeth out, and you'd bring the lower teeth back and make the teeth fit together back here. But that's not what you want. You want to bring these in and bring this back, and it looks better. So you can see her face looks considerably better than it did when we started. And this is pretty close to the time we finished it. So here it is in 91. That was about, we started in 87, so that's 3, and from 87 to 91, that's just 4 or 5 years later. Now we got this lady back several years later. Now we widened this upper arch out, you see, and you see how much wider it is with the big daddy arch wire right there. And down on the bottom, this is a lot broader in here, but we brought these teeth back. As we brought them back, we lined up the lower anterior teeth right there. So here is her picture. Now I think this is about 20 years after we finished the case up. And it was looking very good. And just recently, we found out where she lived, and she was visiting a close friend of mine here, and there's no sign of a class 3 relation here in the top. And even the begonia being out here doesn't detract from it. Now she needs to scale this a little better, keep that clean. She brushes real hard, takes care of them, but she's got a lot of calculus in those lower anterior teeth. I have a dated here somewhere. It's about 20 years since we finished the case up. This is 2010, January the 7th, 2010. And we did this in 87, so that's 23 years later. You can see. Now these teeth here were at Pagonian is still where it was. We brought all these teeth back. And then we brought these where you had them, where they would be sticking out like that before. And you look at this case. Now here it is, 23 years later. And the upper wisdom teeth are just hanging back there. You could take them out if you wanted to. If you don't bother, they don't bother you, just leave them alone. So here she is, 2010, and that was 87. So that's 13 and 10, maybe 23 years with that. And you can see how we brought the upper teeth forward and we widened them and we brought them forward. And here is the cephalometric in 1987, and this is in 2010. Pagonian is still out here where it was. You see here, but the teeth are back here now. And so the upper teeth that were leaning out at that time, now they're straighter up and down, coming in on the teeth out here. Now, this is how the jaw looked back 23 years ago. And there it is, 1987. And here it is, just a few weeks ago. We took this picture of her. And this is where her teeth are today. That's 37 years ago. And it's still holding up. It has not relapsed at all. And it'll be that way when she is as old as I am right now, I do believe. And that was what we wanted to show. Now, if this is correct, I think it should be sent to the universities that you can do class 3 cases that need upper and lower jaw. You can do them orthodontically. And I've done about 8 or 10 other cases if you want to look at them. And none of them have relapsed. Whereas if you just leave the upper back short and you shorten the lower jaw, the tongue will push it back out of place unless you can retain it where it pushes everything forward. But you can look at this. This is 37 years from this point right here to this right here. And it's still holding good. So we are saying this should be looked into by the universities and also by the insurance that pay the price for doing this double jaw surgery, which is a really neat surgery. It is hard to think that a man can do that much to somebody's face and have them live over it, but it can be done, and the surgeons have done a wonderful job of. In some of these car accidents, they have to come out of these things and do that. But I think it is not necessary to do everybody with a class 3 and needs double jaw surgery, or you can do the one that doesn't need double jaw surgery, you can do it too. So I hope you will look at this, and I want to pass this on to the universities as much as we can. Thank you for watching, and I'll close up here again. I'm sorry for my voice being so puny. So I'll say goodbye, and we'll see you later.